Welcome to the May Commission on Aging meeting. It is May 21st. If you can stand it, time is already flying by this year. I want to welcome Mindy Chambrelli, who is our Director of Health for the town of Darien. Thanks so much for coming here today to meet with us. We'll get to you shortly for your presentation as well as a Q&A session. Our first order of business is the approval of the March and April minutes. Anybody have any changes to the March minutes? Hearing none, can I have a motion to approve the March minutes? Thank you. All in favor? I appreciate that.
One abstention.
One abstention.
I wasn't here.
One abstention from Jim, and we're welcoming all. Awesome. Hello, Jerry.
Hi.
Hello, Ray.
How you doing?
Thanks so much. You're just in time to approve our or abstain from our April minutes. Good to see you, brother. Thanks for coming back. Awesome. Yeah, we're in the middle of the meeting, but you know, we got to stop for Ray and Jerry for sure. How are you guys doing? It's great to see you, Jerry. Thanks for coming. Perfect. You want to sit here? Is that good? Perfect. Sounds great. Awesome, and we're still rolling. Awesome. Next order of business is the approval of the April minutes. Do we have questions or modifications? Peter?
Two changes, Joe. The first is that Chris Jones was shown as being present. He was not there.
Got it.
Okay. The second was in the discussion about the Mather Center and seniors and at home in Darien.
Yeah.
The notes say, Mr. Etter explained that they had seen other centers struggle to manage finances based on membership only. And Darien bypassed that model and focused on fundraising. It's not senior centers, it's at home in Darien. It's an aging in place organization.
Got it.
Here are the changes.
Perfect. Thank you. I will send those on to our secretary.
And I must say that the minutes of the meetings have greatly improved in recent months.
Wonderful.
Very few.
Good to hear it. Awesome. Do I have a motion to approve the minutes as modified by Peter? Thanks. All in favor? Awesome.
I wasn't here.
Abstentions, okay, fair enough. We have two abstentions, Mary and Susan. Awesome. Great. So next is our Human Services report, but before we get to that, first we'd like to congratulate Allie. She's now not only going to be doing the Human Services Department, but also overseeing the Mather Center, so congratulations. We wish you all the luck with that. Great. So first question is, will you not, you don't have to do it this month, but starting next month, will you do one Human Services report and one Mather Center report?
I'm doing one large report altogether.
One large report altogether. So should I just call it the Human Services report going forward, or Human Services and Mather Center report?
I think Human Services and Mather Center.
Brilliant. So starting with the June agenda, we will do that. Awesome. So I'll let you, for now, give us just the Human Services report.
I have some Mather Center
Woohoo!
stuff.
Go for it.
Bear with me. Be patient with me. Well, I'll start with the Mather Center stuff then.
Okay.
So I'm thrilled about this. I think, for those of you who know, I think I've said over time that I have a passion for working with seniors. And I did work inpatient geriatric psych, so I do have for 8 years. So I have a background in geriatrics. But this is exciting. Of course, big shoes to fill from Beth. But Liz and Dawn and the team down there have been they've been working obviously extremely hard, and they've had a lot of help from Jen Tarneski, the town administrator, and Susan Barksdale, HR director. But so now Liz O'Brien is promoted. What's her official title here? She's the Senior Program and Events Manager. And Dawn Roy, who started in February, was part-time, and she's now full-time, and she's going to be the Programs and Events Assistant. So the two of them will run the day-to-day, and of course Chef Judy and Nino and Peter, the two building attendants. And then my responsibility will be more of like the management and the oversight and staffing and issues like that. But there's going to be changes, and we're welcoming feedback from the seniors. We'll do some kind of survey in the near future just to see what changes they would like, or positive, negative, whatever. So we're looking forward to it. So be patient with me. But so I'll just go to the Mather Center section then. So well, you guys I think all saw, I don't know if you did see, but Jen Tarneski made the announcement yesterday. And actually Beth had met with me, well, over the last few years she said it to me, but even in the beginning of the year, saying that when she does retire, she recommended this also. So she was in support of this, because this is how other towns are doing, because there's so much overlap between both of our departments anyway. We already do so much work with the seniors. So it's just like a natural progression. And one thing that we are doing is next Thursday, all the staff, myself included, at the senior center are going to be CPR trained. I think some people have been over time. I know I have, but I wouldn't be comfortable doing CPR because it's like one of those things we don't practice it. So I think you have to do it every 2 years. So next Thursday, Post 53 is coming and training everybody. Instead of going through all of the programs for June, just some highlights coming up for June. That we are doing, Cynthia and I are doing the QPR, that suicide prevention training down at the senior center on June 3rd at 12:30, so right after lunch. And we're saving 25, you can have 35 people, but we're saving 25 for seniors and then 10 for anyone else in the community. So if we don't get 25 seniors, we'll have more spots. And then
Sorry, Ally, right?
Yeah.
Guys, one meeting, no comments while she's presenting, okay? Go ahead, Ally, keep going.
And then just a couple of highlights, and then I did actually attach the whole program to the minutes, so all the details, but these sounded fun. So Magic with Tom O'Brien on Thursday, June 12th, and I guess he's geared towards working with seniors, and apparently it's supposed to be fun. And karaoke on June 24th, which I don't know if anyone's ever seen it, but it's quite entertaining. So it's just the seniors getting up.
Yeah.
Right, are you gonna sing, Jerry?
Oh, definitely.
Do we have a song yet? Do we have a song yet?
Yeah, girls just
practicing?
wanna
Oh, Cindy Lauper! Oh, fantastic. Okay, Sherry Genovese as Cindy Lauper is a must-view. I agree with that. Awesome.
And then also on June 26th, Joe Larchevek, the director of Post 53, is coming and presenting on when to call 911. So now I'll go back to human services, and obviously there's so much overlap because a big concern, obviously, and I'm not saying anything political, but that the potential cuts to Medicaid and food stamps is terrifying for a lot of adults, or not adults, seniors, but also families, everybody. But I don't know if you all saw that the governor announced on May 19th that he declared it a fiscal emergency, and so that they will continue to cover, they won't make any cuts, at least this year, to benefits, so that's a relief. But it's between the food stamps and Medicaid, obviously, that those are our most vulnerable people, between seniors and low-income families, so keeping a close eye on that.
Do we, could I just ask, do we have a sense of how many people that will affect in Darien?
In Darien, I could find out the numbers, but I think in Connecticut, I did bring, I think they said more than 900,000 Connecticut residents receive health care through Medicaid. 900,000. But at Darien specific, I don't have that number.
I mean,
Yeah.
I'd be curious to know.
Yeah, I could probably find that out.
I can give you a related number. Folks below the poverty line in Darien, 65 and over, with income below the poverty line the last year was 3.7%. The state average is 7.9%. So I mean, we have a low number, but it translates into 160 people in this town.
Yep.
That's for the seniors only, right?
That's right.
Yeah, because then we also have families.
Well, this is
obviously.
right.
Yeah,
And this is
So-
what we're focused on.
I know, yeah. So what else? Not much else, just energy assistance. We still have some people coming in. We have till May 30th for people who have heat with electric and gas. And my usual medical supply, like it's booming. We have so many people who are donating or, wanting to borrow stuff. And then our emergency call list, because before you know it, it'll be hurricane season.
So did SWACA give you your focus thing you were looking for, the focus center, or is that still up in the air?
Thank you, Joe.
Yeah, sure.
They are reviewing it. I
Okay,
need to submit
got it.
all the paperwork, yes. So what is it called? That was something new to me because I'd never seen it. You might even know, Peter. But yeah, every town in SWACA's catchment area, they're considered, what's it called, a focal?
Yes, focal point, maybe
The
that
focal
was it.
point, like
Yeah.
of where, like, to get services for seniors.
Mhm.
So Joe had to quickly, because I didn't receive the first email, it was due like last Monday, and I was like, okay, I'll try to get this done. I never received I think it might have gone to Beth or something. But yes, thank you for that. So we got it all in time, the deadline.
That's the key.
I'll tell you guys more about it next
You
time.
definitely need to be the focal point for that particular thing, so that's
Right.
good. Awesome, thank you.
Thank
Any questions for Ally?
Comment, Joe.
Yes, sir.
when you have post-53 talk, you might also have him focus on this end-of-life form, the most form
Oh,
that he's
yes,
talking
yes,
about.
that new one, yeah. Okay, I'll ask him.
Other questions or comments for Ally? Hearing none, thank you so much, and once again, congratulations. And now, without further ado, Mindy Chambrelli, our Director of Health for the town of Darien, is going to provide an overview. Mindy, how long have you been in town now for doing this job?
So I have officially been Director of Health since July 1st,
Got
so
it.
we're coming up on a year.
Yeah.
But I have been with the town for almost 12 years
Wow.
as a field sanitarian. And I'll talk a little bit about my former role and my role that I've moved into now with the promotion recently. So I'm going to walk you through a PowerPoint that's going to help keep me on script, share some information about our department. I'll kind of also tell you who we are as a health department and what we're not as a health department and some of the seasonal things that we get into. So this picture obviously is me on the right, but that is me at the YMCA pool doing an inspection. That is our only pools in town that are opened annually, so they get an annual permit from us, and we're in there, I would say, quarterly to look at filtration and look at chemicals and just ensure safety. But we are in a very busy time of the year, which I'll get into also, which is all of our public pools that falls under our authority. Do you want me to sit or stand? Can everybody see me okay if I sit?
Very good.
Okay,
Very
yeah,
good.
we'll just making sure. So new leadership. Again, I've been in this role since July 1st. This is a little bit about the composition of our department. It's very small. We're staffed very lean. The former health director, David Knopf, some of you may have known him. He retired June 30th of last year, and we were fully staffed for approximately 1 month before our public health nurse, Paula Sutliff, announced her retirement. So I was filling dual roles there for a few months, for like the first 6 months or so of being in this position. I was still doing some of that field work, some land use, some inspections, and then I was also filling the role of director. And we have 2 new sanitarians that have joined our team. One just celebrated a first-year anniversary in January of this year, and then we have a new sanitarian that joined us in December of last year, so she's still 6 months in.
What does a sanitarian do?
So a registered health sanitarian is basically an environmental health specialist. Okay, so they do all sorts of inspections, regulatory work, things that we're mandated to do, following up on complaints. It's a very broad responsibility. We have a new office administrator who moved from upstairs in Public Works. She joined us in August of last year. We share her with Human Services. So we get her 75% of the time, and then Allie's office gets her support for a quarter of the time.
We're all in the same suite.
Yeah, we share a space.
Perfect.
We have a part-time nurse, so that nurse that left only was working about 15 hours a week. So again, staff very lean. We have 1 part-time food inspector, and they are certified by the state to only do food. So he cannot do a lot of our land use things. He doesn't go out and do other inspections that we're mandated to do. And we have a part-time grant-funded public health emergency preparedness coordinator. And that position is only a few hours a week, and it's funded entirely by grant.
What grant would that be?
It's a DEEP grant, so it's through DEMIS, and it's also through DPH. But it's specific to emergency preparedness, and actually all of that funding source came after 9/11. So they started kind of pushing money into that. And thank goodness that has not been on the chopping block yet from federal cuts, but it may. So just the mission of our health department is to prevent disease by promoting a safe community and healthy environment for all residents and visitors while upholding public health-based regulations which protect the quality of life. So again, this is based on the composition of our department. The majority of the work we do is environmental based, right? Which is why we now have 2 full-time health sanitarians. Prior to Jovan starting in January of the previous year, there was just myself. So I was the only one doing most of this work. We had 1 part-time person that was doing food inspections, that's it. I was doing all of the other regulatory work that we're required to do, which is a lot.
And what is it exactly? What are you going out and looking at?
Okay, so there's things that we're mandated to do. Well water, septic systems, food service, daycare inspections, public pools, cosmetology. All of those things we're mandated to do. as a regulator.
By the
And there's-
state?
By the state.
Okay.
And there's timelines in which they have to be done. So for example, a place like Selleck's Woods or Avalon, or I'm sorry, Atria, we're mandated to be in that kitchen 4 times a year at a minimum because they serve an at-risk vulnerable population. So there's certain timelines of things that we have to do to be compliant with the state public health code. So a place like that, like a Selleck's Woods, Atria, a Maplewood, we're in there 4 times a year doing their food service inspections. And that's using FDA format. So it's not a Darien inspection form, it's not a state code, it is a federal code that we're enforcing, which is through the FDA. So again, most of our work is that environmental piece, and food service would be under environmental. Community health and promotion, which is a collaboration between the director and our part-time nurse, because that's the only people that we have to do that kind of outreach and promotional work. And then that emergency preparedness person that works within the region. So Darien falls within Region 1, and then we also work with emergency management, so that would be Mark in the fire marshal's office. And what we are not. So I kind of talked about who we are, but who we're not. So we do not have a laboratory here as part of our health department function, and we do not offer clinics. So unlike other health departments in our neighboring communities, a Stamford and a Norwalk, they have clinics where they have the public come in and they're giving childhood vaccinations, they're identifying ticks, they're doing testing, they're testing for STDs, for example. We do not have that here because we're so small. And same with the laboratory capacity. So right now, one of our health sanitarians is out doing beach water sampling for the first time this year. He's out at Pear Tree and Weed this morning. He will drive those and courier those to Stamford. So we utilize Stamford Lab for our testing for our bacterial levels in our public beaches. So again, that's who we're not, because we're not as big and we don't serve a population as great as our neighbors. So that's who we're not. So again, some of our mandated roles, I know you had asked. So things that we're mandated to do is that list there, and that's a statute. So we are statutorily mandated to do food inspections, to follow up on lead reports. So if we get a child that's showing elevated blood lead levels because they've been exposed to lead somewhere, we're mandated to follow up. Septic systems, so anybody that is on a private subsurface septic system, we are involved in that. Water quality, daycare inspections, cosmetology, beach water sampling, and reportable disease, which I didn't talk about yet, but we are on the reportable disease follow-up. So we see all that surveillance is happening at the state level. So we have access to all those records. And monitoring emerging diseases, identifying at-risk populations, targeting intervention based on that data, right? Improving health outcomes of our entire community, and then that emergency preparedness. So you can see I put this slide in here because everything is really interconnected to the social determinants of health, which, any of those things can affect somebody's health, safety, and well-being. So again, big emphasis on environmental things, and these are the regulatory and policy enforcements. Food is a very broad category, so not only do we have the permanent places, like everything on the post road that's open year-round, we have seasonal places. So this past couple weeks has been very busy in my office as the country clubs open their pools and their snack bars and their 7 Teas, and the Little League field that's opening up their food snack shacks. We have to go in and open all of those places. So again, that's very formalized. Itinerant vendors, so if you see a food truck at a job site downtown, we've seen it, we've inspected it. Seasonal, temporary events, so that could be something at Tilly Pond. The Chamber's having an event. Our Parks and Recs departments just had something at Selleck's Woods over the weekend. I don't know if anybody participated in that, but they had a food truck out there. I think Mr. Softy was there also. We look at any of those temporary type events that are serving food to the public. Subsurface systems, and then I think this list we've kind of walked through. I will call out those personal services. We're mandated to go in there for inspection. All of our reports are available online, which the public sometimes doesn't know. You can go in and look at a food service inspection or a cosmetology inspection, and all of the inspectors' comments are there for public review. I think we're the only health department in the state that does that. So, and we're continuing to do that, and I'm very proud of that transparency with our inspections. Recreational shellfish permits. So, people will come into our office and get a permit for, to shellfish in our area. We have maps outside of our office, so if you leave and you're interested, our office is right, shared space with Ally. You can take a look at the map of where the approved shellfishing beds are. It's kind of interesting if you're into that. And I will go into some of our vector surveillance, because that's happening now. And then childhood lead cases that we're involved with. The community health piece, again, that's that surveillance of disease, investigation with needed, building the community health needs assessment I'll talk about later, and then just that public information. So anything that we get in from the state, we're pushing out. So some of the seasonal trends that we're seeing now, I don't know if you can see, this is actually a picture I took of this poor little bunny, but if you can see in his ears, what do you,
Ticks.
yeah, those are all ticks. Those are all ticks in this rabbit was actually running through my yard. So, yeah, so this is the time, I think yesterday I received 3 tick reports in one afternoon. One person hit the jackpot because the tick that they had on them was a black-legged tick. But it had 3. It had co-infections. There were 3 agents that they tested positive for. And we're seeing that more as the years go on. We're seeing more co-infections. So it's not just Lyme disease, but it's antoplasmosis, it's babiosis. So a lot of co-infection happening.
Just for people on TV 79, it's a big question everybody has. How fast do you have to get the tick out, right?
Well, you want to do a check as soon as you come in.
No question.
Yes.
But if within 24 hours, within 12 hours, what does the science show?
What they say, what the science shows is that Lyme can transmit after 24 hours.
Got it. Okay.
So the sooner, but there are agents, and I won't get into them, that will transmit within 15 minutes.
Whoa.
There are some. Very rare, but there are.
There.
Ticks are just bad.
Yeah.
Ticks are bad. So actually so let me just walk through this, and then I'm going to take you to a couple links that I think are pretty fascinating, and you can delve into more when you have time. In June, actually June 2nd, the trapping sites will open in Darien, and these are through the agricultural station, experiment station in New Haven. They have 2 trapping sites in Darien, I'll show you where they are, for mosquitoes. There's over 54 species of mosquitoes in Connecticut. Just a little trivia, if you're ever on Jeopardy or, you get asked a question. And we do passive and active tick surveillance, and that's through the ag station, also the reports that I receive. And these are only the ticks that people submit for testing. Oftentimes people will call, I pulled a tick off of my child, I pulled it off in pieces, I'm not sure what to do. I said, well, you can send it into the lab, but there's no guarantee there's going to be enough content for it to be tested, and it has to be engorged in order for them to test. So it really has to be feeding on you, and it can't come from an animal. That's another question we get asked often, like, I pulled it off my pet, can I have it tested? And really this program is free, and they will not only identify the tick, but they will test it for 5 different agents. So we want to keep those resources to human biting ticks. So that's through the ag station. We've started our beach water testing today, right? So I always like to test before we go into Memorial Weekend, and then we test every week through the whole summer, okay? There's a beach hotline, and information is also on our health department website. So that beach hotline, if there's a closure, I will put a message on there that the beach is closed due to exceedances in rainfall. And it could be preemptive closures, which we do in Darien. That's over an inch of rainfall in 24 hours closure.
So how long will you keep it closed for?
At least 2 tide cycles.
Okay, so 24 hours.
Yep.
Minimum.
Yep,
Right.
minimum.
So we got an inch of rain scheduled for Thursday.
I know.
Right?
Yeah. Well, the beaches aren't technically open. This is baseline.
Got it.
This is baseline. So we don't really open beaches until the guards are there, which is going to be over Memorial Weekend. So that's the unofficial opening
Got
day
it.
for all the pools and all the beaches.
Fair.
So even if we get the rainfall, we're not going to close because we're technically not.
Got it.
But that's a good question. So what we have shown through our linear regression models that we have in the office over the years is that an inch of rainfall is enough of a runoff to merit closure. Okay. So 1 inch preemptively, and then any elevated bacteria will close the beaches. So again, public pools, farmers markets, temporary events, this is the time of the year where we're getting all that stuff in our office. We're issuing shellfish permits. I'm going to share with you this really interesting public health tool. I don't know if you've seen it, but it has to do with wastewater surveillance. It's a new trend. It's very up and coming. I think it's going to be a lot more, it's going to be recognized a lot more moving into the future. So I just want to introduce you to that. And then situational awareness. We're always watching things, right, in public health. The needle's always moving. What are we looking at? So for a while, we were looking at all the measles cases, which they're still going up in the Midwest. We do see measles cases every year, but we haven't had the amount of pediatric deaths in the last 2 decades. So we've had at least 3 pediatric deaths this year from measles. Unheard of. Unvaccinated folks. And then H5N1, bird flu. Right, everybody's heard that in the news, the price of eggs. Remember the whole thing at the beginning of the year. So we're continuing to just watch that and see how that evolves. And then Oropouche is a new, it's a new mosquito-borne illness. It also can be found in little biting midge. I don't know if you know what those are, but this little tiny flying insect. But we're watching that because that's moving up, same as ticks are moving up from the south. We're seeing new and different kind of ticks that are carrying different diseases. So again, this is just that situational awareness. We're always kind of just keeping our ears open to what's happening. And then hurricane season. I know Allie mentioned that hurricane season is starting June 1st. So, you know, our health department role would be if, you know, there's a potential for flooding or power outages in any of our permanent establishments, which we had that historic flooding last year, you know, and paying attention to what's happening with our permanent businesses. Now let me show you a couple of these websites that I referenced in this slide. The first one about mosquito trapping. So here's a map of the state, and this is where the Agriculture Experiment Station does all their trapping, and they'll be the same for this year. This is just the map from last year. But we have 2 sites in Darien. Get to us right here. One is at Brush Island, and the other mosquito trapping site is near the high school. So on either end of town. I don't know why we were lucky enough to get 2, but I guess there's 2 in Norwalk too, but that's a bigger geographic area. So that's kind of interesting, and that's going to start June 2nd. And as soon as we get a mosquito that tests positive for West Nile, I always issue a press release. Last year it was earlier than the year before. Right, and same with ticks, like we're getting tick reports earlier than we used to. And that is because, you know, in the winters aren't as severe as they used to be. And it's just, you know, it's those transitional months are kind of going away, right? And then here is, I wish I could make these bigger. Let me just see. Okay, this is easier to see. So Lyme disease with ticks, black-legged tick, deer tick, the most common reported vector disease, right, in Connecticut, without a doubt. And you can see now, the reason the last few years were so high is because they had changed the definition. There was a revised case definition for Lyme disease. Because not only is it's not very straightforward sometimes with testing and diagnosis. So they changed the definition, but if this represents even a fraction of people, and you know, you still have people where they're not reporting things, they're not sure what's going on, they haven't uncovered what exactly is happening. But our incidence rate in 2022 is 51.6, which is high. But if you look at some of these other numbers, Vermont, Rhode Island, Maine, and then, oh, here's cases of Lyme disease around the country. And you can see the Northeast, we're just completely covered with Lyme disease. And it has to do with that pesky little black-legged tick. It's the most pervasive tick in our area. So you can see how much is there. Unlike any other parts, you know, there's different ticks that they have to worry about. And a lot of it, you know, some of the agents of concern you don't see in black-legged ticks, but they will test for these kind of things. So the tick that I got yesterday that had all 3, the co-infected tick, they had both of these and Lyme. Yeah. And then wastewater data, I think this is such an interesting trend because you know what it tells? It's not the most glamorous thing, right? We're testing wastewater. But what it shows is, you know, it'll show people that aren't sick enough, right, to receive care somewhere. So these are cases that, you know, somebody could have foodborne illness, for example, and not be severe enough to go to the doctor. So the statistic from the CDC is 1 in 6 people will experience foodborne illness every year. So if you think about us in the room, that's 3 or 4 of us. I don't want to volunteer for it to be the 1 of 6, but oftentimes people will not go in and get diagnosed. So that's why this kind of tool is really going to be important moving forward. And I'll show you why. So some of the current data, so here's some of the things they're testing for, and there's different programs that are testing. This is just the one through Yale that's looking, but it's different areas. There's one in Stamford too that there would be our wastewater, right, our public systems that are going through there. But we'll just look at, and norovirus also is not a reportable disease through the CDC. It's a stomach bug, basically. It doesn't get reported. These other 3 do. So influenza, let's just look at this. So, you know, we had a terrible year this year with flu. I don't know if anyone had a bout of flu, but look at these numbers in February. It's amazing, and this is just passive surveillance. This is just monitoring wastewater of what they're seeing for the viral load to be, right?
What is that, a concentration? I can't read.
It is.
Milliliters per.
Let's see, what's the metric they're using? They probably have it somewhere.
It's on the left-hand side.
Is it? I'm
It's on
sorry.
the
Right
left-hand
there.
side, but is that per like?
Virus.
Genome copies
Oh, here,
per
I'm
ml.
sorry, you're right. On the per milliliter.
So that would be
Yes.
like almost 600 per milliliter for February of 2025.
25, yeah. Yeah, right. 'cause
And is a
it's
copy
across.
a case or what?
Well, so I'm not sure how they do this data. Like I mean, I could obviously provide you with the
Oh,
link.
just
over.
curious,
Yeah,
yeah.
yeah. I really don't know. I don't want to say
Okay.
how exactly they do this, but you know, they have those monitors in place, and this kind of technology has been progressive over the last few years. They used to just do flu. They used to just
Right.
do a couple of things, but now they've added in RSV. They also started looking at H5N1, right? So bird flu.
This is
Some of
where
the data.
artificial intelligence is gonna make a huge, the
Yeah.
ability to analyze, and they've been collecting data so long, they'll be able to go back. And
Yeah.
so It's gonna be
And see.
amazing.
Yeah, I mean, because look how long they've been doing it.
Yeah,
But it's finally getting some press, I think, as they get better at this. But you know, this also, you put this on top of actual case counts too. And there's an exact correlation here.
That's
it's
where I
like
was trying to
mirrors-
go, is to like
Yes.
the number of cases.
Right,
yeah.
right. And I do have the number of cases that were reported that people actually got tested. So don't forget, if you go to the doctors, they're not always gonna test. They may just say, based on your symptoms, we think it's flu. And it may not get reported as that. If it's a laboratory confirmed case, then we have a case, right? So what this represents is people that may be staying home for a few days because they're not feeling good, right? So this tells a different story than what we might get when I go to the state database. But it overlaps, it's mirrors one another, so
And this only captures data from the public sewer system,
Yep.
correct?
that's right.
So all of us
The
on
private,
septic,
Yep.
we're not in this database.
exactly.
Yeah.
Yep, you're right. So let me go back. So again, you know, that's COVID, right? COVID numbers. RSV, norovirus, and actually we had a terrible, same time as all the respiratory illness we saw the same sort of thing with norovirus. It was like that big spike, actually it was worse than last year. But that's the GI bug, right, stomach bug. And not reported, so this is good data to have, right? Because those don't get reported to our surveillance system. And then these are just different genotypes, right? Because everything, it's like COVID broad, flu broad. Do you have flu A? Do you have flu B? Easy way to think about this. It's when they actually get down to the subtyping, right? That gets down to the particular agent. Okay, let me get out of this. So that's just kind of new things. I thought I would just spend a couple of times showing you some of the things that we pay attention to. And current initiatives for this year that I've been working on is we're participating, and Ally's been participating too, with Stamford Community Health Needs Assessment through Stamford Health. It will be ready, and I think they're gonna present it in the fall, so that'll be an open invitation to the community at that time. Looking at health data, and also developing a health improvement plan based on the data. Now, the data is collected in a qualitative fashion and a quantitative fashion, right? So we have hard numbers that we're pulling from like a data haven source, from the CDC, those kind of numbers. And then you have the qualitative piece that they do with community partners, interviews with the public. So it'll be a really great report. And a lot of the themes that are rising to the top are the ones that we've seen in the previous community health needs assessment. It has to do with access to care, it is housing issues, and behavioral health. Those are the three things that are rising to the top again as needs in the community. Workforce development, so you saw I have a very green staff, everybody's pretty new. So I'm making sure that they are up to speed with, you know, looking at and evaluating some of our really complicated septic designs, and we do have a lot of them here. So, and a CPO is a certified pool operator. Our inspector that started in early December just completed that course, so now she's well versed in pools and filtration in order to open up all of our seasonal pools this year. And emergency preparedness, that there's a lot of FEMA courses that they need to take to get on board if there were ever to be an incident where we had to respond here locally. The Advisory Board of Health, I'm also looking at my advisory board that was established in 2008 and kind of revamping and rebranding our mission, because where we were then is not where we are now. So we really need to take a look at that, the composition and the really mission of that particular board. We're supporting human services with the QPR and mental health first aid trainings. Our public health nurse that retired in February used to co-teach that with Ally. So once we get somebody on board to fill that position, we'll offer that again, you know, that level of training and support for her program that she's been running. OpenGov, that is a huge project for this year that I put in as part of my capital, but it's to fully integrate the health department into the town's OpenGov system, right, which is all that land use stuff. Someone wants to put a pool in, they have septic, somebody wants to add in another floor to their house and they're on private water and private sewer. Our office would be involved with that. And any new places coming in, because you see all the development happening in town, and all of those retail spaces that serve food to the public or offer a cosmetology service, those businesses will come through our office for a comprehensive plan review and opening inspections and then regular inspection. And then that leads me into our development of a 5-year strategic plan, which I hope to do this next year. We'll see how that goes. And it's how do we meet those 10 essential services. So on my very first slide, you had that big pie that was there. And that really is, I didn't talk about it, but that is the framework of public health. And it's how do we meet all of these 10 essential services that public health is responsible to do in the community. And some of them include, you know, alignment with the community health needs assessment. So based on what comes out of that report, we want to be able to strategize, like where should we be emphasizing, right? What is the highest need in our community? And again, that involves, you know, town leadership and utilizing any resources, asking for resources if we need them, support and insight from my advisory board of health, any programmatic focus that we need to do based on, you know, an ever-changing landscape in public health, and to continue to develop my workforce. That's public health. It's very messy, but it shows the interdisciplinary nature of the field. And so not only is it, you know, healthcare management, environmental health, but it's health policy, it's biostatistics, it's all that disease surveillance. So it's very interwoven, all the things that we do. So we have to be aware of that when we're planning and when we're delivering services to the public. But you know, the health department's strategic plan is to work with the senior population by tailoring programs that will meet their unique needs. So however that shapes up to be. And we did do a media campaign this last year with one of my grants that were cut. Actually, I had 2 grants this last year because of the federal cuts that just got a stop work order in late March. One of which was to fund a vaccination campaign, and we did that as a region. And we did a back to school campaign that talked about childhood vaccinations. We did vaccinations for seniors and for, I'll show you that on the next slide. And then we did travel vaccines, so people that are, going on spring break and they're traveling to other countries. And that is a question we get quite often, actually. And our neighboring health departments, we usually push them over there because they do have vaccines available. So for traveling. So again, Allie and I have talked about, collaboration with her new role in the Senior Center and how can the health department be more involved in what's happening down there, whether it's programmatic, whether it is, a health screening, like a know your number type concept where we're doing like a quick glucose test with our nurse that comes on board, offering blood pressure checks, things like that. But again, that statistic I put in there is from post 53, but the number one call that comes into our post 53 is falls. It's related to falls across the board and specifically in an aging population, right? So most of those calls are coming, in the senior group. And, some other matter of balance, and I think they do have something similar to that has to do with falls at the Senior Center, but again, I think that's an opportunity for us to supplement some of the existing programs that are already in place.
They do have it, it's Fairfield University School of Nursing.
Is it?
Mhm.
Yeah.
But it's not constant, it's like periodically that they have like a 12-week course.
Yeah, great. And so here's something we did with that campaign that we had to stop when we got the stop work order, but we developed a website with a QR link and it walks people through vaccines that they should be getting over certain ages. And those that, traveling, for example, you have the pneumonia vaccine, right, people over 65, so it's very clear what the recommendations are and for at what risk. So high level risk, traveling over the age of 65, which vaccines you should get. And then I always like to end with our accomplishments of last year. So although, public health is kind of being scrutinized at the moment, but, COVID-19 is no longer a top 10 leading cause of death, right? STD infections are lower than they've been, they're declining. There was, in Connecticut, there's a reduction to the childhood lead poisoning action level. So that was an EPA change that we're now enforcing in Connecticut. So now we go out and do a full comprehensive lead screening if a child has a lead level of 5 or below. Before it used to be much higher. So now we're more proactive. EPA drinking water standards now include the 6 PFAS. I think that's up on the chopping block too. That may not happen. Healthier standards for kids' meals and air standards in the classrooms. Opiate deaths declined for the first time in decades, which is great news because you've all heard about big pharma and all of the lawsuits associated with opiates. So that's a real win for us. Firearm violence was declared a public health emergency last year, which is great, right? And there's been an equity focus on all aspects of public health, so that's kind of across the board now. And then the innovations that have been happening in local health, including that wastewater surveillance models that I showed you, that new tool, and improvement in data collections and that transparency that comes from the state down to the locals. And that's all I have, so I'll open it up for questions, comments, or areas that you think that the health department should be involved with.
I have one question. And Sue now is on the blight committee. I used to be on it in
Okay.
town. Does the health department get involved if there is blight and, for instance, it's attracting rodents and all of that? Who is responsible as part of that? That was always an issue we had, was when does it become a health issue? Not just the fact that, the neighborhood doesn't.
It's unsightly, yeah. I would say if there's evidence of rodents, then we should certainly be involved because we can't issue orders.
And how about environmental, for instance, molds, all of that type of stuff?
So it's interesting you bring up mold because there really are no standards for mold. I mean, I can't you would need to be an indoor air quality, like a professional to come out and be able to evaluate, and there's extensive testing. So just because you see mold doesn't mean it's dangerous,
Right.
per se. It's not good, but you really need to get to the root of the problem.
Right.
Right? And that's what my default is always, okay, you have mold, you need to eliminate the moisture, right? The source of. But as
But
far
if
as
asked,
rodents-
you guys would get involved if you felt like,
Yeah.
yeah, okay.
I think you
Yeah.
were in one of the original ones where there were rodents in
Well,
the
yeah,
house.
we,
Mhm.
I remember we started going down
Oh.
that path, but then
Yeah.
didn't.
And then, in years past, since I've been here for 12 years almost, I would bring Chip Stahl, our animal control officer. There's a new person there now. But, collaboration with him to really identify whether this is an issue.
Yeah. Okay.
And there's ways that you can tell, the burrows and,
Peter?
Both a question and a suggestion.
Okay.
Has At Home in Darien had some connections with the health department in sharing of information? And if not, I think you should, because we have to remember that the senior population, which by the way, officially is now 20.1%, people 60 years of age or older. 10 years ago it was 14, is now 20.1%, and we've reached that benchmark. Senior population does not use the senior center as the 4,200 people that are at home in Darien. So I'd encourage you to build that information, because it's terrific information that you have, okay? Second, really is a question. Yesterday, I received from the State Department of Aging the 2025 Connecticut Health Aging Community Profile Report. Joe, I'm going to send you a link to that, and you can send it out.
Yeah.
And I just printed out the Darien statistics, and I know you've had this probably for weeks or months, but I just read through it, and really fascinating information. But the thing that concerns me is in talking about the overview of Darien, it says, wow, 49.5% of men and 44.9% of women 65 and older completed all CDC recommended vaccinations and cancer screenings. I'm concerned about that when I read in the paper, for example, that COVID boosters are going to be limited to people of age. Our town did such a great job with COVID, I think, in providing the vaccinations. And what I'm really worried about is that what we should have in place plans to be aggressive this coming fall in this area, given that there might be some constraints. And I just wonder, have you thought about this, talked about this, and what you might be thinking about?
Good point. And I didn't talk anything about the COVID vaccine, but we were very involved in all the clinics, especially with the first eligible group, right? Which was the older seniors, and Ally's office and our office worked very closely to make sure we pulled seniors in that were eligible based on the brackets, right? So I think first it was 80 and over, and then it dropped down and kept dropping. And let me just say that was the most fulfilling time professionally, was seeing the seniors come and how happy they were to not only get the vaccine, but to be out and socializing. We almost had to kick them out of the 15-minute waiting room. It was like, okay, there's more people coming in, because everyone had been so isolated. So thank you for bringing that up. But Ally and I have had offline discussions about offering, like a clinic downstairs, and we did in years past do the flu vaccine and have that, but the numbers just kept declining, and reimbursement was declining. We were losing money. Basically, we were paying to get the flu vaccine, and it didn't make sense a few years ago. But in light of that, I think we should consider doing something this fall.
I would encourage you, as one of those 4,200 people, I would certainly encourage you, plan ahead and realize that we may be even in a more critical health situation for elderly people at this time. Thank you.
Other questions? Hearing none. Mindy, thank you so much for coming. Very interesting presentation. Really appreciate it. And you're welcome to hang out for the rest of our meeting. We should run another 15 minutes or so, or you're welcome to check. Okay, cool, great. Our next order of business is an election of a vice chair of the Commission on Aging. Why is that necessary? We haven't had one in forever. But secondarily, I'm not going to be here for the July meeting, so I need someone to run it. Thankfully, Sue Oki has put her hand up, but for election purposes. Oh, yeah.
Well, somebody put her hand
Somebody grabbed her hand and yanked it, correct. But I don't know who that would be. Is there any other person who'd like to be vice chair? Hearing none, can I have a motion to approve? Sue, yes, all in favor? Aye. Congratulations, Sue, you're vice chair, so she'll be running the July meeting of the Commission on Aging. Thank you so much. Also, if you can't reach me, call out to Sue and she can take you whatever it is. Thank you, Sue, you're the best. Okay, old business. Peter?
A few things. The
Thank you.
Darien Library completed 1,700 tax returns this past year. 1,700, which is up from 1,050 last year, so a great activity. A couple of things on SWACA, okay? One important thing, I think, is that the Aging Connecticut Summit for the third year is going to occur on Monday, October the 6th at the Turf. Last year, there were 425 registrants and it was sold out. And I would encourage our town to be represented there. And again, there'll be a lot of information, I'll send the link out. But it's really important, and I'm going to be focusing on issues that we talked about, like loneliness and isolation. So that's important.
Peter, will you repeat that? It was October
It's
6th,
Monday,
AquaTurf?
It's Monday, October 6th at AquaTurf. Right. And again, they'll be putting out some information in the next month or so. Interesting meeting at SWACA this past month, and again, it doesn't affect us, but I think we should, I just want to mention it. One of the new issues that SWACA is looking at is the rise of homelessness among seniors, and it's a real problem. Because now if you're a senior and you're pushed into a homeless shelter, and there are more and more people in our state being forced to do that. Homeless shelters, for example, for the most part are overnight locations. So now you have seniors that are living or sleeping in homeless shelters and then pushed out on the street during the day. It's just symptomatic, I think, of how frayed the safety net is becoming, and something that we need to pay attention to. Related to that, Marie Allen had us send a letter to legislators, and I'm just going to read a paragraph of this. The state budget has proposed an increase to the cost share for state-funded Connecticut home care program clients. The current cost share is 3%, with a proposed increase to 5% for July the 1st. This means that for every $1,000 of care received by a low-income senior, they will need to pay $50 in cost share compared to $30. This might seem insignificant to us, but for a low-income senior dealing with higher energy, food, and health care costs, the additional expense may be overwhelming. Just one example of the kind of pressure that seniors are under in the whole healthcare arena. Tomorrow we're having, we'll be up in Hartford, we have an ARP reception for legislators, and the session is winding down. And we have powerful players that represent this town. Senator Duff is the majority leader of the Senate. I mean, we have Cece Mayer, also a powerful force in the state level. And then representatives like Blumenthal, for example, very active in voting and extending voting opportunities for seniors. I would encourage everyone, I really would encourage everyone to watch what's going on in Connecticut, and if you have the time, at least represent us as seniors. Last thing, and I'm going to have a handout, is I mentioned last month about the Ridgefield first Senior Expo. Chris Jones was there. Chris was there, and he can talk about it as well. It was amazing. So Ridgefield has a town, about 27,000 people. Interestingly enough, there are 5% more people 65 or older in Ridgefield than there are in Darien, so it's a bigger population. There were 600 people at that event. There were 61 exhibits at that event. It was fantastic. It was put together by 5 of the 8 members of their Commission on Aging, and Mike Downey, who is the Director of Social Services. It was an amazing thing. But the thing that really surprised me was the table of the Senior Tax Committee. So I'm going to pass this out. So the Senior Tax Committee had a table at the event, and it was probably one of the most visited tables there. I think I made enough copies if I didn't just share.
It'll be in the minutes.
Just flip it, Joe. So it's a very simple survey, but look at the second page. So there's a simple explanation of eligibility in the town of Ridgefield. And I mean, we have a lot of the same kind of values, but what's amazing was how public and how vocal they were, and how they reached out to their citizenry. And I know you've talked about it, we talk about it occasionally at somebody at the senior center. But again, I think it's a marvelous example of what the town is doing. This was the booklet that came out. I have a PDF on it that I can send you, but they said they might be able to send me some copies. So I could send it to you, to Allie, to Chris, for example. Take a look. I'm not recommending we do it because I'm not going to volunteer for it. It's a lot of work. There's a lot of work involved, but boy, was it successful. Was it successful. Chris, you might want to add an observation.
Yeah, I mean, impressive. Peter, while he didn't mention it, ran a breakout session and gave a really good presentation to a real crowded room. But the event itself was just shocking in how big it was, and as you mentioned, 61 vendors. I mean, I stopped off at a couple of meal delivery programs from that people are doing. Some parallels to things that this town's doing. So it was very interesting.
You good?
That's it, Joe.
Great. Chris, what else is going on at
Okay,
Darien?
well, most important thing, our annual appeal, our spring, which is our first version of the annual appeal, we continue, I think as most of you know, be almost completely funded by private donorships. So the appeal is real critical. Especially critical, we've had some of our long-term bigger donors that have kind of cycled through, and we're doing more. This year in particular, Peter mentioned isolation and loneliness. I've talked about that. We're going to be doing more, in which we articulate in our letter. So we're doing that. The passenger van update, we need to probably regroup. Joe, you had talked about something. We are taking 13 seniors to Yo-Yo Ma this Sunday down in Stamford as our first real outing. And that was great. Sue really spearheaded that as the head of our van committee, and purchased tickets, and then they were gone, and we had a waiting list, which was great. And we are also working on rolling out a program. We're talking to some of the local restaurants. It looks like we're going to do the first one to Paparazzi, and we are going to bring a group of seniors to get a specially priced meal on a select lunch or dinner. And so we're excited about that. So we're going to be communicating about that more. But take a step back though, and want to echo the comments that have been made about Allie and assuming that role. I'm not sure there's a bigger advocate for at home in Darien as well as the seniors. Maybe not outside of this group, but so we really look forward, and I personally look forward to working even more with Allie on behalf of the seniors. So that is great news. We have our annual luncheon that is usually in the fall. It's going to be in the spring. It's actually next Thursday. Typically about 110, 115 people. There's still some spots available, so if anybody, TV 79 is listening, it's free. We're going to have Art Gottlieb speak, free lunch. Art Gottlieb is a frequent presenter down at the Senior Center, and I've just heard great things about him.
At the DCA.
At the DCA, correct. And very recently, the Darien Men's Association had got together, and they almost unanimously voted to adopt us as their nonprofit partner.
Nice.
So we're looking to do a number of things, and we want to bring them value, but they're certainly bringing us value. They're going to run a golf tournament July 7th, which all the proceeds are coming to us, and they are really running it and managing all the moving pieces. So very excited about that. But beyond that, it's, you know, it's a great organization and a great group of people who are in that. And we want to do more of that with other organizations, you know, to benefit seniors. So.
Awesome, thank you, Tris. Other questions for Chris? Other old business, I'll report on 2 things. I have been in communication with the Sellex Woods folks about their issues with what's going on with the new big building going nearby them and the demolition of the existing building. We've talked with them, putting them in touch with the folks in town to try to keep working on that. We've also had a wonderful letter I had to write relating to our ongoing issues at the Royle and snow removal. Obviously, thankfully it's May, so this is not an issue currently, but we will continue to stay on top of that because so far at least we're butting heads, not getting a lot of responses.
Did you get any response?
No response?
Nothing, wow.
Yeah, so at the end of the day, we may need to upgrade this in the fall to a selectmen's issue if in fact we continue to see nothing. I mean, they've invited us to a meeting, but based on not responding to our letters, I'm not sure that the meeting is
Who
good.
invited us to the meeting?
In the letter from one of the folks, they said, well, why don't you may want to come to a meeting of the, you know,
Housing
Housing
authority?
authority.
Housing authority.
Really? When is that? I'd be
I-
interested in going.
Okay, so let's find out when, okay, so let's do that. One of our action issues will be to try to find out when the next housing authority meeting is.
I
And
can find out. It's
Okay.
pretty even on.
might be on the web, thank you. And so Sue, would you be our representative and rattle their
Indeed,
cages?
yeah.
Awesome, okay, so we'll keep the ball rolling there. Other old business? Hearing new business, do we have any new business? Yes, ma'am, Jerry.
I wanted to just let you know that there's a place in Stamford, it's called Evergreen, and it's a daycare, adult daycare with people with mild cognitive impairment. But I spoke to Gabe, his last name is, I just want to let you know, Ally, so you have it. He said that he's trying to make it like a place where people could socialize, that, you know, even if they don't go to a senior center, but they have something going on mentally, that, not to call it for mild cognitive impairment, but just as a social club. So it's on Newfield Avenue, and it's called Evergreen, and his name is Gabe Corrado. Corredor, Corrado. I don't know if you heard
I
of him.
remember you told me about him.
Yeah. So I go there once a week with little Rosie, and I'm just watching him just excel with the people that are coming in, and it's a nice group of people. He's got great volunteers, and he also has people that do like if somebody needs something for their family member at night or on a weekend that he could recommend. So it's kind of a great program that's going on over there. And he's looking to expand into Bridgeport and Norwalk. But I just thought I'd let you know in case, I mean, I'm sure you get calls all the time.
How big an operation is it?
It's pretty big. It's
Like 20 people a
no,
day or
no.
more?
He's got like 25 people.
Mhm.
Sometimes less, but it's a 5-day program.
And it's an independent nonprofit or is it subsidized?
You could probably call him and check and see, because I just got involved in it now, and I didn't go into all the questions with him. So I wanted to hand it over.
I'll find out.
Yeah. Okay.
And Sue, the housing authorities, May 27th at 6:30.
May 27th?
Yeah, May 27th, 6:30 at the Heights, the community building. That's the building right in the center.
What's really nice too, they supply them lunch, breakfast, lunch, and they leave like 3-4 o'clock in the afternoon.
That's nice. Yeah, there's not many daycares. I mean, I don't know, it's
There's
not quite
nothing.
No, there's
Not
one in
around
Greenwich
here.
and in Norwalk
Yeah, because that Waveney,
closed, or
Closed.
closes, you know.
so there's really nothing around.
Mm-mm.
So this is, I think it's a terrific program. He and his wife are doing it, and, you know, he's got like nice staff too, which I've been involved with seeing them for the past year. So you could call him and get all the info if you'd like, okay?
Great. Thank you. Any other new business? Hearing none, can I have a motion to adjourn the May meeting of the Commission on Aging? Thank you, Sue. All in favor? All right, thanks, everybody. We'll see you in June.